Gerontology is more than just studying the aging or their medical aspects. It's becoming aware of the different cultures and the corners of society that make up our aging population. It's also about laws that protect our aging and how it's going to affect their quality of life. It's more than just a number, gray hair, laugh lines, and wrinkles. It's also about self-determination. There are many aspects of aging, and we'll all go through the aging process whether we want to face it or not. There are many things that we all have to take into consideration, and they are important regardless of the degree to which they will all affect us. From our health care to our end-of-life care. Stereotyping is huge in our society. Many people, young and uninformed, have this thought that all old people will have dementia. They're all cranky, slow, weak, and ill. Well, that's just not true. However, our media is forecasting and projecting those images. And as a result of that, that may be because they may be drawing these inequalities on our views of aging and our legislation. However, the baby boomers are breaking through that stereotype by living longer and more active lives, as well as having higher levels of education, access to better insurance, and retirement plans. More people are working longer, and some even find second careers after they've retired from their first. Centenarians, more than ever, are alive today, and it's expected that we're going to have even more in 20 years. Culture also factors into ageism more than many people think. The different cultures that make up our country, even though there are many of them, we still have barriers. Each culture has its own traditions, and we need to honor and respect those more than we do. We need to take into consideration their differences on healthcare and family care and their views on them. We cannot think that everyone's going to age in the same manner into one nice, neat little package. So even in death and dying, there's differences in the cultures, and that needs to be respected. Society no one society is aging faster than another. We're all aging at the same pace. We need to embrace these different cultures and incorporate them into our society more than we are now. More bilingual service people would be a help. We can get more bilingual people into services and programs to help the aging. The more will become involved. Now, as we age, we all may end up having to take more than one medication at a time. There are some concerns. But there's tools out there, like the Beers criteria. It's a great tool to use and still used to this day, even though it's a couple of decades old at this point. It'll tell you the disease and what to and what not to take. Cost is a huge concern. Do the elderly have enough money to pay for some of these medications? Does Medicare Part D cover it? Things like that are very important. Complications, are doctors communicating with their patients and vice versa so that people aren't getting prescribed wrong medications that could cause more harm than good. The elderly can get confused. With as many medications they may be taking, many of them may look the same, so they may take them at the wrong time or with the wrong coordinating prescription because they do look the same. So caregivers could help with that and making that a straight shot with their medication. Disease prevention. There are many diseases like diabetes, obesity, and cancer that can be avoided, whether it's environmental or a lifestyle change. Cardiovascular disease is the same with hypertension, all based around diet, activity, and moderation in our diet. Big thing there, though, is the exercise. Getting exercise is going to keep away diabetes type 2. It's going to alleviate obesity. Right now, our aging population is more obese than it ever has been. Things like cancer, that's an environmental issue. Smoking, not smoking. You want to smoke or chew any tobacco product you can get a cancer from. There's throat cancer and mouth cancer, so it's not just smoking, but there's also drug abuse. Chemicals can cause cancer. These things have been proven. Cognitive behavior later in life, train of thought. We all lose that from now and then. Not a big issue. We can catch back up. Sometimes we may forget where we put something down and later find it right back where we normally would put it. Problem comes when there's an organizational processing in the brain. If you can't draw a face of a clock or you can't put a certain thing in a sequence, there's a cognitive issue there. Confusion. Confusion can come at the same kind of processing. If you're not processing why you came in the room, you have no idea. You don't know what that room's for. You may think it's a bedroom, but it's actually, say, the laundry room. There's a cognitive loss of cognitive function there. Emotional changes can be a cognitive issue as well. That could be a chemical imbalance, but it could be just the loss, a huge loss of cognitive function. Cost of home care for elderly is probably the most important one because it covers more than just, say, the cost of medication. It's the cost of care, paying the person to come in home. If you have a family member who's had to leave their job, that's a cost because now there's no income coming in for them. Safety is a big issue. Modifications to the home. Is the home safe? Modifications can be as simple as putting in extra rails in the bathroom, a walk-in tub, extra lighting in the hallway, activated lights so that when you're walking into your room, they just automatically go on. There's also, if you have somebody coming into the home, there's abuse to consider it for in-home care. Even if it's a family member, that can be an issue. Is the care that's being given correct? Are the available resources for any follow-on care adequate? Whether somebody is getting end-of-life care at home, in a nursing home, or a hospital, that is a personal choice. And it's the self-determination that needs to be remembered because it's the most important thing about end-of-life care. In order for a person to have what's considered a good death, they should be afforded that opportunity to make their own choice. Care should be done so that a person maintains their dignity and privacy. At no time should anyone be exploited during their end-of-life care or during their time of death. One of the most important things a person can do to make sure that they're getting that self-determination is to make sure they're putting it in writing. There are forms, living wills, powers of attorney, things of that nature that they can get filled out prior to any end of life where they cannot make those decisions for themselves. They can even put in writing on this documentation somebody to do it for them. Right and wrong, basic ethics. We have all learned right and wrong from a very young age. Everyone wants to be treated with respect and equally. Nobody wants to be abused, but there are elders that are abused with laws to protect them. However, some of the elders won't report the abuse because they're afraid that they're going to be left alone without anyone to watch over them. Autonomy, very important to the aging as it keeps them empowered over their own life and decision without being influenced. Documentation will get them to keep their autonomy as they can identify somebody as their guardian or caregiver by just using an advanced care directive or forms like that. Legislation, that's very important. We go back to those elder abuse laws and some of the laws that govern over our health care. It's activism that keeps those things rolling, and we need to keep the older people involved in that activism to get their voices heard. All of these issues regarding age should be talked about individually and throughout our community. Many of the cultures in our society still need to be accepted and honored. Some of our cultures that have been here for a few decades, they're starting to lose some of their traditions because they're assimilating. But that means they're believing in some of the stereotypes that the baby boomers are kind of weeding away and getting away from because they're working longer, healthier, and happier. Healthcare programs and services still need some changes, but they're going to have to change as we change and age as a population. It's only going to work if the legislation continues to change, and that's only going to work if we keep involved in activism and we keep the aging voting and getting their voices heard. Coming together with this legislation will bring society a little closer together as we all age